How to use health care coverage. In the United States, if you get sick or injured, medical care can be very expensive. A single emergency room visit, test, or hospital stay can cost thousands or even hundreds of thousands of dollars. Healthcare coverage is meant to help a person manage those costs. However, coverage isn't the same thing as free. Someone always pays. There are several main types of healthcare coverage in the U.S. Many people get coverage through an employer, often called employer-sponsored, or job-based coverage. Medicare is run by the federal government, and Medicaid is administered by the states. Those who are 65 or older and others, regardless of age, with certain disabilities or diagnosis qualify for Medicare and can choose either traditional Medicare or a Medicare Advantage plan. People with lower incomes may qualify for Medicaid. There is also coverage for veterans through the VA and coverage for active duty service members and their families through TRICARE. There is also specialized coverage for federal and state employees. Those who do not have access to government programs or affordable employer-sponsored coverage can buy insurance on their own through the marketplace. Some states, including Kentucky, run their own marketplaces, while other states opt to use the federal marketplace. Small businesses also have access to insurance coverage through the marketplace. Most coverage programs require a monthly premium to keep coverage active. When a person receives medical services, such as visiting a doctor or having a medical test, they often have additional out-of-pocket costs, such as deductibles, copays, or coinsurance. These are known as cost-sharing expenses. The exact amount a person pays depends on the coverage program, the type of plan they have, the location of care, and how the plan is designed. There are a few key words that are relevant to almost every healthcare plan. Let's walk through what they mean. First, there is the premium. A premium is the monthly cost to keep coverage active. The premium cost is paid whether the insured person receives medical services or not. If the premium is $300 a month, that payment is due each month just to stay enrolled. If a person has employer-sponsored coverage, the employer will pay some, although not necessarily all of the premium cost. Most people who qualify for Medicare Part A do not pay a premium for that portion of coverage, but some do. Medicare Part B, Medicare Part D, and Medicare Advantage plans also have monthly premiums. People who buy coverage through the marketplace also pay premiums, although some may receive income-based discounts. Next is the deductible. A deductible is the amount a person or family must pay out of their own pocket before their plan starts paying for most services. The family deductible is typically higher than the individual deductible. As an example of how the deductible works, if an individual deductible is $1,500, the insured must pay the first $1,500 of covered medical bills themselves. After that, the coverage plan begins to share the cost. Under the Affordable Care Act, many preventive services are covered at no cost for people with commercial coverage such as marketplace plans and employer-sponsored insurance. This means that even if a person has not met their deductible, they should not have a copay or coinsurance for covered preventive services. Medicare has different rules. For example, Medicare does not treat a yearly physical exam as preventive care in the same way that private insurance does. Once someone meets their deductible, they may still have to pay part of the allowable charges for future services. A copay is a set dollar amount a person pays for a service. For example, someone might have a $25 copay to see a primary care provider for a sick visit or $10 for a lab test. Sometimes there are multiple copays for the same visit. For example, someone with a sore throat might pay $25 for the history and physical evaluation and another $10 for a throat swab to check for strep. Copays are usually due when you are seen. Coinsurance is not a second type of insurance, even though it sounds like it. It is different from a copay. A copay is a set dollar amount. Coinsurance is a percentage that can vary depending on the type of service and the specific plan benefit structure. Coinsurance costs are calculated based on the allowable amount. The allowable amount is the payment the provider has agreed to accept from the insurance company or the government for a given service. It is almost always lower than the amount originally billed. As an example, imagine a surgery has an allowable amount of $1,000. If a plan has 20% coinsurance and the person has already met their deductible, they would pay 20% of $1,000, which is $200. The plan would pay the remaining $800. If the person has not met their deductible, they must pay toward the deductible first. If the deductible is $1,000 and nothing has been paid yet, the person in this example would pay the full $1,000 allowable amount. If the deductible is $500 and nothing has been paid toward the deductible yet, the person would first pay $500 to meet the deductible. Then they would pay 20% of the remaining $500 or $100. In total, the person would pay $500 toward the deductible plus $100 coinsurance for a total of $600. For large medical bills, coinsurance costs can add up quickly. Some financial protections exist. For commercial plans, there is a limit on how much a person can be required to pay for covered services in one plan year. This is called the out-of-pocket maximum, or MOOP. Plans usually have one out-of-pocket maximum for an individual and usually a higher limit for a family. The out-of-pocket maximum includes the deductible, copays, and coinsurance. Once that limit is reached, the plan pays 100% of covered services for the rest of the plan year. It is important to note that monthly premiums do not count toward the out-of-pocket maximum. Another important part of healthcare coverage is the plan network. A network is a group of doctors, hospitals, and other providers that have contracted with an insurance program or plan to provide services for agreed-upon amounts under what is known as a fee schedule. If a person sees an in-network provider, their costs are usually lower. If someone goes outside the network, they will likely pay significantly more for care. For plans that do not offer out-of-network benefits, the insurance company or coverage program will not cover any costs for out-of-network care, except in emergency cases. Here is an example of how all of these work together. This is Kevin. Kevin pays a $300 monthly premium for his health insurance coverage. The deductible for his plan is $1,500. After he meets his deductible, he has a 20% coinsurance for in-hospital care. His plan has an individual out-of-pocket maximum of $7,500. Kevin was admitted to an in-network hospital for evaluation of chest pain. The allowable amount for his 3-day stay is $10,000. Assuming Kevin has not yet paid anything toward his deductible, he must first pay the $1,500 deductible. That leaves $8,500 remaining on his hospital bill. Coinsurance applies next. Kevin pays 20% of the remaining $8,500, which equals $1,700. Kevin's health insurance plan pays the other 80%. In total, Kevin would pay $3,200 for his admission. His $1,500 deductible plus $1,700 in coinsurance. This does not include the monthly premiums he has already paid throughout the year. If Kevin continues to need care and his total out-of-pocket costs reach $7,500, his insurance plan would then pay 100% of covered services for the rest of the plan year. Healthcare coverage helps a person manage large medical bills, but it does not necessarily remove costs completely. The monthly premium is only the starting cost. Deductibles, coinsurance, copays, out-of-pocket maximum, location of service, and network rules all affect what someone pays when care is needed. It is important to remember that even if a person keeps the same plan, the deductible and maximum out-of-pocket amounts start over at the beginning of each new plan year. Looking at all of these pieces together gives you a better idea of what your healthcare needs may cost over the course of a year.